Hi, I'm Dr. Joe Brown. I'm a board certified and licensed naturopathic physician, emphasis with cancer. Many people are looking for alternative cancer therapies. They don't know where to turn. You hear of stories like Suzanne Summers and some of the celebrities. They get diagnosed with cancer. The first thing they do, you hear, they fly over to Europe. They do cancer treatments for 4 or 5 months. Then they come home, they're cancer free. Here in the United States, we're such a pharmaceutically driven country that a lot of these people who are diagnosed with cancer are stuck in this regime of doing chemotherapy, radiation, and surgery. And if it doesn't work, and a lot of times it doesn't work, what else are they going to do? So one of the things that I'm here to talk to you guys about today is this. If you're diagnosed with cancer, here's one thing I want you to understand. There are more options than chemotherapy and radiation. Like I told you a second ago, I'm a board certified naturopathic doctor with the emphasis of alternative cancer therapies. Here in Tempe, Arizona, this is what I do. I specialize in alternative cancer therapies. I'm a board certified doctor. I work with a lot of the medical oncologists and many of the hospitals and independent clinics. We have a lot of these therapies in from other countries so that when people are diagnosed with cancer, we have other treatments for you guys to do. One of the things that happened to me 13 years ago is I was diagnosed with stage 3, late stage 4 melanoma cancer, which affected me here in the left side of my lymph node gland in my neck. The cancer was spreading everywhere. I didn't know what to do. I didn't know who to turn to. I didn't know who to ask questions to. And so my point of talking to you today is I want to get the message out to people, especially to people here in the United States, that there are more options than chemotherapy, radiation, and surgery. It's something that I got to a certain point in my particular diagnosis that I didn't know what I was going to do. I was left hanging where I didn't know what therapies to do. Well, the doctors who treated me told me, they said, Joe Brown, listen, we've done 3 surgeries, we've put you on an experimental vaccine, nothing's worked. At this point, I would recommend to you that you guys pack up your things, your belongings, because in about 3 to 4 weeks, even if I give you chemotherapy and I give you radiation, you're not going to make it. Your cancer is spreading too fast. I'm not a foo-foo person, but I was having a hard time understanding that and going along with that concept. I had a gut feeling that this just wasn't the right thing for me to do, that there was something else out there for me to do. Making a real long story short, I came across a number of naturopathic treatments that are out there. There's different treatments such as high-dose IV therapy, high-dose vitamin C therapy, Ukraine treatments, Iscador injections, also called mistletoe. You have diet protocols that are with the emphasis on cancer. Even the Dr. Oz, Oprah Show, and a lot of these nutrition books are referring to this. You have Chinese medicine and herbal treatments, infrared sauna beds, glutathione injections, immune stimulating therapies. There are a whole host of treatments that are out there for people who are diagnosed with cancer. And so one of the concepts that I want to get across to you today is that there are more options than chemotherapy, radiation, and surgery.